What is the ERAS? So this is a fast track project to improve the outcomes that was initiated in the colorectal surgery and then expanded by a group of academic surgeons to improve the perioperative care, and now practices in among the most of the surgical fields. Aims of the ERAS in cardiac surgery is to decrease the unnecessary variation, improve the quality, safety, and the value for the patients. In 1990s, the Professor Henry has developed this ERAS that was started in the colorectal surgery because of the traditional approaches have increased the complications in this surgery. Kelly's work has highlighted by the benefits of reducing the surgical stress by using the epidural analgesia, regional anesthesia, and that has improved to faster recovery of these patients. ERAS Society was made in early 2000. That was started in colorectal surgery. Aims of this study, these protocols, to establish the guidelines that were based on the latest and evidence-based practice. The initial focus of ERAS was the colorectal surgery, and nowadays it is on the cardiac surgery. The global trends in ERAS. The European countries were the first who has started the ERAS in cardiac surgery and ERAS in other fields of the cardiac surgery. Mainly it was started in the Germany, Sweden, and UK. In the North America, the Mayo Clinic and Cleveland Clinic have the robust protocols. While in the Asia, the Saudi Arabia and Singapore have started this ERAS in cardiac surgery, and their focus is to improve the patient outcomes in high-risk surgeries like cardiac surgery. ERAS in cardiac surgery has proven to improve patient outcomes, reduce recovery times, and minimize the complications and multidisciplinary approach. The collaboration between the multiple healthcare experts, like including cardiac surgeon, anesthesiologist, nursing staff, physiotherapist, nutritionist, pharmacist, and hospital administration team. So before establishing the ERAS in cardiac surgery, everyone should know the roles and responsibilities of each and individual. The roles and responsibility of a cardiac surgeon is to oversee the surgical procedure and ERAS protocol integration. He should adopt the minimal invasive approaches and reduce the trauma. He should collaborate with the team for the preoperative care strategies. He should oversee the patient selection and surgical planning. Cardiac surgeon should ensure the adherence to the ERAS guidelines throughout the surgery. Nursing staff has an important role in establishing the ERAS by providing the patient education on ERAS and set the recovery expectation. Monitor the vital signs to ensure the postoperative recovery. Manage the wound care and infection control. Assist with the early mobilization and faster recovery. Role of pharmacist is to manage with the medication protocol to prevent the complications and to prevent the side effects or overdosage or interaction with the drugs. Physiotherapist should plan and integrate the early mobilization and physical rehabilitation strategies for the patient. Educate the patient for breathing exercises and physical activities, and monitor the cardiovascular endurance exercises of the patient after the surgery. Nutritionists should optimize the nutrition from the preoperative period till the postoperative period. Develop the nutritional plan that reduce the insulin resistance that will prevent the wound infections. Recommend the perioperative dietary regime and after the recovery. Hospital administration role is a crucial role that they should facilitate the ERA's implementation and training and education of the nursing staff, allocating the resources and funding for the necessary equipment and the staff, managing the hospital policies to incorporate the ERA's protocol, and ensure the departmental collaboration between the ERA's team. Promote the ERA's adherence by managing the cost and reimbursement processes. So before implementing these ERAs, we should assess the current practices of the hospital. Perioperative patient education, anesthesia management, what are the current medications, and pain control method, early mobilization practices, and the post-operative care and nutrition. So ERA's guidelines have divided into 3 phases: is a preoperative, intraoperative, and the post-operative. Preoperative phase consists of the patient education, nutritional support, and rehabilitation. Intraoperative phase, the main focus of intraoperative phase is on the anesthesia management, the use of multimodal anesthesia, and reduced use of opioid medications. Fluid management, ensure the goal-directed therapy to maintain the hemodynamic stability and prevent the fluid overload. Temperature control, like most of the cardiac surgery, should be performed either in the normothermia or the mild hypothermia. Blood conservation strategies should be used. In the post-operative phase, it is based on the pain control, early mobilization, early nutrition, and post-operative monitoring. Training and education of the staff and familiarize the staff with the ERA's protocol is necessary before implementing the ERAs. Develop the patient and family education material. So how to measure and evaluate the outcomes? By continuously monitoring the outcomes such as reduction in the length of hospital stay, decrease the post-operative complication, patient satisfaction, readmission rates, and overall cost saving. On these 5 parameters, every hospital should conduct a pilot study. That pilot study will evaluate your results, and then you can implement your full scale implication of the ERAs. These are the ERAs practicing centers. ERAs practicing centers, their main focus is to reduce hospital stay, is to reduce opioid use, and they have saved around 20 to 40% of the hospital days, and they have saved more than $2,000 per patient. So ERA's implementation is to implement once the pilot is successful, then implement the protocols across the entire cardiac surgery department. Then keep reviewing the new practices of ERAs and the cardiac surgery, and continue the training and education of the new staff and patients to prevent the sustainability of the project. So what are the benefits of the ERAs? ERAs protocols have led the shorter hospital stay by 20 to 40%, and ERAs has reduced the post-operative complications. There is an economic impact of ERAs in cardiac surgery that is about $2,000 to $205,000 per patient has been saved by using minimal invasive cardiac surgery approaches. So cost benefits is you can see this is literature has shown that for a shortened hospital stay on each patient, hospital have saved $3,000 to $5,000 per patient, and 2,500 patients on decreased ICU stay. So challenges of the ERAs are the ensuring the adherence to the protocols. This is the global challenges, and managing the variations in the practices of all surgeons, addressing the barriers related to the resource and training. What are the challenges in the Pakistan? Resource constraint is the number one, and the cultural barriers, staff training, then the data collection and the monitoring. This is a short video that differentiate the traditional and the
Teams of great healthcare providers that want to provide them the best care possible. Henry goes to get him ready for surgery. Just like preparing for a marathon, Mike is learning and preparing his body and mind for the best possible outcome. Mike learns about the importance of stopping smoking and drinking. He learns about the importance of eating healthy, and he engages with his healthcare team to make sure his medical conditions are well managed, especially if he has low hemoglobin. He also learns about mobility before and as soon as the first day after surgery. His whole family gets involved and encourages him during the training process. Mike learns about what to expect after his surgery as well. He has a full understanding of the process and is now prepared for the big day. Even leading up to the day of surgery, Mike is given specific instructions for proper infection prevention measures and carbohydrate drinks. Mike is encouraged to drink a clear sports drink or apple juice up to 2 hours before surgery. In the operating room, both Henry and Mike's healthcare teams are well trained in providing great care. But Mike's healthcare team is empowered by the knowledge of cardiac ERAS to further enhance his care. After surgery, Mike's healthcare team continue to use goals of cardiac ERAS to get him progressing smoothly through his recovery. Because of all the hard work that Mike and his team put in before, during, and after the surgery, Mike is able to recover faster and sooner than Henry. Henry and Mike both recovered from their heart attacks after surgery. But with cardiac ERAS, Mike was able to recover faster, decrease his risk of complications, and get back to living life sooner. Be like Mike. Choose cardiac ERAS.
Any questions?
Thank you very much.